Detox is the first stage of treatment. Essentially, detoxification means removing toxins from the body. But in this context of treatment, detoxification refers to the treatment of any withdrawal syndrome associated with the abrupt or gradual cessation of the drug or drugs that the person has been taking at the point of coming into treatment. So detoxification does have to be managed safely. We want to also ensure that detox is as rapid as possible so that the person is not on any medication for any prolonged period of time.
Some patients are quite anxious about the detox. They've read frightening stories of what happens if you go cold turkey, or even if a doctor is helping you and you haven't had enough of the medication to make it safe and comfortable. Getting a balance between having a safe detox but not giving so much medication that the individual feels over-sedated or confused is quite specialized, and our staff have special methods which they use very well to keep a good balance. This is an important first step, but for us that's not an isolated block. That's a period when the individual is going to meet his therapist. The individual will have his or her buddy from the community group, will be getting to know them. They'll be getting involved in the life of the community, even though they won't at that point be starting on anything more demanding in terms of their psychotherapy.
We do provide our various complementary therapies to assist people, such as acupuncture, aromatherapy, stress management techniques, and these are invaluable in assisting the withdrawal process.
Detox can be dangerous for alcohol withdrawal and unusually for withdrawal from benzodiazepine drugs such as Xanax, Valium, Librium. Both alcohol and those benzodiazepine detoxes can result in seizures, epileptic seizures. And that's why we monitor people very carefully and use a sliding, gradually diminishing dose so that the brain readapts, gets used to having lesser and lesser amount of the substance present, while not putting the brain through anything risky that could provoke a seizure. A detox from opiates such as heroin or methadone, oxycodone, tramadol, codeine actually isn't medically dangerous. It's not life-threatening, but it can be pretty unpleasant unless it's done gradually and or with some substitute or protective mechanisms, medications we use. The atmosphere is also very helpful. Talking to other people who've been through detox, and of course there are going to be a lot of the other patients that you'll meet in the community who've gone through detox, they can reassure you and give you that little bit of extra confidence, and keeping your own level of fear and anxiety under control actually helps the detox to go through more smoothly.